I'm here because of the potential of HIFU to enhance the immune response. I haven't truthfully seen clear evidence that this is happening, but I think the potential is great. What I appreciate about the technology is its non-invasiveness, but I also like the idea that it can be such a gradient of either imaging to gentle destruction to complete destruction. And one of the serious barriers to improved immunotherapy is getting the immune system into tumors so that they can recognize and destroy tumor cells, which they are very capable of doing, and we know that's true. The problem is we have to get them into the tumor so they can do their work. And there's a lot of evidence now that patients who have tumors that are infiltrated by a lot of lymphocytes do better. They do better not only in response to immunotherapy, but also to radiation, to chemotherapy. So there's this very important relationship between the ability of lymphocytes to infiltrate tumors and do their job. So some tumors, pancreas is a good example, are so dense and so apparently difficult for lymphocytes to get into the spaces where they need to work. A technique like HIFU might make that possible. And I could see it becoming immediately feasible to test that idea in the clinic because of the non-invasiveness of this procedure. It's a similar problem that we have in immunotherapy to get drugs inside tumors too, because the blood vessels often are closed. There's high pressure in some tumors that collapse blood vessels that prevent blood from perfusing into the tumors. And actually that's the system that the immune cells also traverse into the tumors. So this idea of pressure and inside of a tumor is collapsing the blood vessels actually is relevant to not only chemotherapy and radiation, but also to immunotherapy, because we've got to get those lymphocytes into the tumor to do their work. The problem is that tumors have learned how to evade or suppress the immune system. The environment inside tumors can be very dangerous for immune cells. So that's why being able to change the environment of a tumor from the outside without having to open up a patient or to do surgeries or to use drugs for that matter, which may or may not combine well with immunotherapy, is very attractive to me. And I see a great potential for HIFU in modulating the interior of tumors to make the immune system work better. Oh, I think that the evidence that I see that is very encouraging is the fibroid destruction. The non-oncologic applications have been very exciting so far, and I can see the potential for cancer therapy. So far, the animal models have been difficult. It's tough in a tiny mouse to do ultrasound. The equipment is not the same as we need for humans, and so without strong animal or preclinical research, sometimes it's difficult to convince the medical community of the value of a procedure when they're doing something which is easier and getting good effect. So I think it's hard to convince the medical community to try something different without clinical evidence that new therapy is better than what we're currently doing. There's quite a few people here that are interested in thermal therapies, and ultrasound is one of them because of its potential to change temperature deep in the body. So normally many parts of our body are kept at a very stable temperature. The core of a human is about 37 degrees or 98.6 degrees Fahrenheit. Hyperthermia is a field that aims to use a temperature shift to either improve blood flow in the case of mild hyperthermia, but as you get to higher temperatures to be able to instantly ablate or kill tumor cells from thermal coagulation in a very controlled way. So there are different ways to change temperature. Ultrasound is one of them. Another is microwaves. Another is various forms of internal devices which heat up. I think probably the most exciting field right now is the nanoparticles, which can be made to become quite hot with a superficial magnet or magnetic field applied. So there's a variety of different applications of thermal therapy. And that is also a field that I've done a lot of work in. And I appreciate the value of mild temperature shifts to improve blood flow, to improve lymphocyte delivery, to improve radiation. These are the areas that I and my colleagues have worked in terms of hyperthermia. So that's how I heard about ultrasound to begin with, for its potential to change temperature. But when I come to the ultrasound school here, I see so many more applications in imaging and besides therapeutic applications. It's very versatile. This cavitation process is fascinating to watch. That's really one of the things that got me excited about the field, was seeing Larry Crumb's movies of cellular debris in a fountain where the ultrasound sound waves were focused. And I thought that that creation of micro parts of cells could be a great stimulus to the immune system. For the immune system to work, macrophages and cells in particular called dendritic cells have to pick up pieces and parts of cells that have an antigen on the surface. And I know it's complicated, but it actually has to represent those antigens on its surface in order to attract a passing lymphocyte. So the process is not direct, it's quite indirect. And one of the problems is getting pieces and parts of tumor cells to be taken up by dendritic cells in an efficient way to activate T cells. And I see that as a powerful, the ultrasound can be a tool to make that happen. So it's one of the reasons I'm here, is to learn more about that.